In rural West Alabama, what happens when an ambulance doesn't show up in time for your medical emergency? I'm Caleb Aguayo, and I'll show you what it means when medical care is far away and you need it. Ambulance services in Pickens County are in critical condition, and healthcare funding is to blame. A similar problem also led to the closing of the county hospital, and families like Yumiki Stewart's are juggling with the impact of the lack of medical services.
It is ridiculous that we don't have a hospital to go to. And you have to travel so far. Like my mom, she's sick, and she have to travel like to Tuscaloosa. It's like 30 miles from Reform to Tuscaloosa, or vice versa. You have to go to Columbus, Mississippi, to Baptist Memorial Hospital.
Families like the Stewarts aren't the only ones driving further for medical care. Ambulance crews are forced to drive farther after the closure of the hospital in 2020. EMS Director Vicki McCrory says they also lack the county funding to operate on their own.
We're fully aware that the county really doesn't have, $250,000 a year to subsidize the ambulance service. We're well aware of that fact.
Pickens County's EMS service operates its ambulances in partnership with Tuscaloosa's North Star Paramedic Services, but the Pickens County service still loses more money than it makes.
We would love to be able to support ourselves, but honestly the only way that's going to happen is if the hospital opens back up.
This is Pickens County Medical Center, a local hospital with about 50 beds. It closed in 2020, laying off up to 200 county residents, but it still stands with the lights on. Down the road from Carrollton is Reform, where Dr. Julia Booth runs a clinic for non-emergency needs. But since the hospital's closure, more and more patients have called in for emergencies.
I can't monitor somebody for 6 or 7 hours. I can't do IV fluids for 6 or 7 hours. I can do a few hours of IV fluids, and I'll take up a room and do that, and it probably makes no sense to my bottom line, but you're going to take care of the patients that are in front of you.
Booth says she's not properly equipped for all emergency cases, but she says she and her staff do the best they can. Residents say a hospital would give them the access to emergency care they need.
We need emergency room, we need x-ray, we need lab. You have to go away to Tuscaloosa to get x-ray done. You have to go away to Columbus to get x-ray done.
Kiervan Latham is a former Pickens County emergency room staffer who says the healthcare system is vital to the community.
A lot of people don't drive. A lot of other people cannot drive. A lot of people, even mid-age people, cannot drive. Then you have to wait weeks before you get the results back for your local doctor can tell you what's going on with you. That's unnecessary.
With an overworked and underfunded EMS crew and a closed hospital to serve the 19,000 people who call Pickens County home, there's no resolution in sight for the near future. Families and former employees hope the county commission and city leaders will come up with long-term solutions sooner rather than later. For the University of Alabama, I'm Caleb Aguayo reporting.